Okay, hi class. We're group 6. I'm Maddie. It's Ashley, Cameron, Neray, and Leanna in our group. And we're doing our presentation on Madeleine Leininger and her transcultural nursing theory. So a little bit about Madeleine's background. She's a nursing professor, developer, and theorist. And she's the founder of this theory we're talking about. And even though her theory is has an emphasis on cultural appreciation and diversity and being worldly, she had really normal beginnings. She was born in 1925 in the Midwest, raised on a farm in Nebraska with her farmer dad and her caretaker mom. She was the middle kid of 5 children. Her first degree was at a nursing diploma school in Colorado in 1924. 2 years later, she got her undergrad in Kansas, then her master's in Washington, D.C. in 1954, and then her PhD at UW. And she was the first nurse to get a PhD in social and cultural anthropology. And she was inspired to do this because of Margaret Mead, who was a really influential anthropologist in the 60s and 70s, and they were actually good friends. And she was inspired first to do this, to pursue this theory because of her work as a child nurse specialist at a child guidance home in the 50s. She was finding these really stark differences in behavior depending on the child's cultural background. So some kids were white, some were African American, some Jewish, and they all had different responses to care and different needs. And before her work, there was no theories and very minimal studies that focused on culture and care in the nursing environment. And so she 100% paved the way for how things are today. And she conducted her first field study in the early 1960s in New Guinea, which is off the coast of Australia, and went on to study 25 different cultures, Western and non-Western. And she wrote over 30 books and published over 250 articles regarding transcultural nursing theory and nursing in general.
I'll be discussing the 4 basic meta paradigms, which consists of person, environment, health, and nursing. Madeleine Leininger defined person differently than most, where she thought they were mainly defined by their culture. So that's who they affiliate with, for example, their church, family, and or friends. Thus, the nursing client interactions are determined by their culture instead of the individual themselves. Next, I'm going to talk about environment, which is the next one.
Thank you.
Thank you. The environment is based on cultural and physical settings. So that can consist of religion, politics, law, economy, education, language, and history of the culture. Next, we have health, which is culturally defined. It is determined by the ability to perform daily activities in a given culture. This may deviate from a typical nurse-client interaction, and it depends on the person's cultural makeup. And lastly, we have nursing. Ethno-nursing is a big theme. It is how different cultures vary with their beliefs and norms. And given this, it determines how nurses assist clients of different cultures. This is done by providing proper cultural congruent care to give the client the ability to have the best well-being they can in their culture. So there's nothing set, and it's pretty idiosyncratic depending on the client. And it's also a way to help them face death.
So some unique concepts about Leininger's theory is it focuses on discovering comprehensive factors that influence human care. These factors are worldview, social structure factors, language, generic and professional care, ethnohistory, and the environmental context. She believed that having a deep understanding on how these factors make people different through their culture is essential to providing great care. She focuses on the importance of prior knowledge and understanding that different cultures because we can apply it and get creative in planning our care to fit that specific patient. We can prepare ourselves by using the sunrise model, which is her conceptual model that's shown on the slide. These are all important factors that help us determine what areas we need to focus on. The goal of doing this is to have our care support their well-being, health, and satisfactory lifeways for the people. And another unique concept to her theory is that it is designed to identify what is diverse to certain cultures and what is universally related to care. The benefit of this is that we can compare and contrast different cultural practices and beliefs. After identifying universally accepted practices, we can apply that to most of our patients' care. After identifying differences in the certain cultures, we're able to plan and familiarize ourselves with specific care those patients need in order to maintain that is appropriate for the beliefs of that specific culture. And then one example of this unique concept was mentioned by Beth Perry Black. It was a story about a nurse that moved from an urban area to a rural area. This nurse had her own idea of how to treat patients based on her experience. When she was doing a house call, she stayed in her car to finish up her work while she waited for the patient. She did this because she realized that patients are usually late to their appointments in that area. The patient's grandmother invited the nurse into her home while they waited. She refused to come in so she can catch up on the work. Later that day, that family wanted a new nurse because this nurse was rude and offensive. This nurse did not prepare herself for the new culture where being invited into a home is an honor. Sadly, the nurse ended up leaving this rural area because she didn't want to adjust to the new cultural practices in that healthcare. It's important to realize that different cultures have different forms of respect and practice.
Okay, and that brings us to clinical practice and transcultural theory. So how this actually affects bedside nursing. So there's two examples that I have, and the first one includes assessment, and the second one includes providing patient-focused care. So when assessing for a client, this theory states that it should be very important to assess how cultural aspects actually affect the client as well. So when doing an assessment, nurses should include the client in the conversation and ask questions about the patient's background and culture. It is important to do this because, for example, some clients may feel differently about diagnoses, especially ones that could be potentially fatal, and they may even remove or refuse care because of this. So, for example, some cultures that believe in fatalism, which is Mexico and Germany, and fatalism is the thought that all negative effects are predetermined and there's no way to avoid them. And someone with this kind of cultural belief may not accept a diagnosis as it would change the course of their life's predetermined events. So it's important to assess for things like this before starting to give information to clients, as it may affect them differently. And as this theory suggests, we have to understand refusal for care may be deeply ingrained in the client's life, and it would be more harmful than beneficial to start forcing care on the clients in these circumstances. And the second one would be providing patient-focused care. So this kind of goes off of the assessment idea. And the whole thing of nursing is providing patient-focused care, and that should include cultural aspects. And this is what this theory is focusing on. So it is important to involve clients in the creation of their care plan and include their cultural beliefs as well. So the nurse should ask the clients what is important to their culture when they're creating their care plan, and be sure to listen to the client as well and understand for that culture. So this is important in cultures that have different food beliefs, like what is acceptable and unacceptable to eat. So this could play out in a patient that is Jewish or like Seventh-day Adventist, for example. They may have different beliefs about which food products should be removed from their diet, such as pork and other kinds of meat. This is important in the healing process, as food is one of the main things to provide nutrients for clients. So it's important to assess that things before just including that in their care plan. So, as Madeleine Leininger's theory suggests, the nurse may cause more damage to the client by not including the client's cultural beliefs into their care plan and forcing upon a standardized version of medicine.
Limitations of transcultural theory of nursing. While the theory gives a holistic and comprehensive perspective of human groups, populations, and species, it lacks a transcultural reality. Based on Madeleine Leininger's theory, health is defined by each culture. This can be challenging because the client can dictate medical interventions based on the client's cultural beliefs that may not be safe practice in a hospital setting. Yes, this theory encourages nurses to provide patient-specific care, but the ambiguity of culture requires extensive transcultural nursing knowledge and appropriate research methods to safely integrate cultural practices. And from a nurse's perspective, it could be challenging to adapt and integrate the client's culture due to cultural shock. Because it is one thing to read about it or hear about it, about a culture, than to actually experience the culture.
So in conclusion, the main takeaways of this presentation would be assessing for the cultural preferences of the client and including the patient in their care plan creation to allow for the clients to design their own specific care plan and be allowed for them to create the care plan based on their cultural beliefs as well as what should be standardized in medicine. So it's important to assess for these and be sure to provide a personalized care that includes the client's cultural as well. And thank you, everybody. And
Thank you.
Thank you.
thank you.
And here are our references.